Cindy, who do you believe is the most underutilized but most potent member of any healthcare team?
It would have to be the caregiver. Caregivers in a patient's life and a medical setting actually have feet in both worlds. And I consider the caregivers to be the bridge between healthcare and home. And one of the biggest challenges is that our caregivers are often overlooked in the healthcare system. And yet, if we didn't have good caregivers in place, we would wind up with patients that were readmitting to the emergency rooms, have off-the-chart pain problems, couldn't comply with the protocols and the follow-up care. So the first thing is to remember and elevate the caregiver as a co-patient, offer them treatment. That would be a huge shift in healthcare, because right now they're considered silent partners, if even that. And then remembering the patient and family's journey starts when they leave your hospital. And yet caregivers are often annexed. They're often overlooked, disregarded, and not seen as the powerful partners of healthcare and patient care that they are.
Does the panel feel that there's been a difference in patient experience now versus 10 or 20 years ago?
What I have noticed is a continued mission, for lack of a better word, there's a continued mission to promote the doctor knows best, which under certain circumstances is fine. But when you're dealing with, adolescent and young adult cancer patients, whether female or male, you actually may not really know what you're doing, because most cancer patients either fall in the pediatric or the older adult or geriatric demographics. So we're flying so far under the radar that we wouldn't be able to get the medical attention or assistance or resources that we need. Would I be surprised if anything has gotten better in the last 15 to 20 years? I'd be very surprised. Am I shocked that according to Kayla's experience that they have not? Absolutely not.
Kayla, you've been fighting the ebbs and flows of cancer for years. How empowered have you felt to really shape and chart your own journey?
I've had moments where individuals share their insider knowledge and experience in the hope to empower me to be able to shape and chart my own journey. So I quickly learned that to have a shot at being able to shape and chart my own journey, I'd really have to resist the urge to be suppressed by the system. And with these volume-based compensation models, as most common for healthcare providers, that continues to push towards making me one of hundreds. So I think we can do a better job at supporting the individual facing active treatment. And I think that we have through different technology advances and extra care and supportive services. I have yet to see any change though for how we support cancer survivors. Being a cancer survivor is the most suppressed I have felt within the healthcare system. And it's almost like I have to be bald to matter in those hallways, as sad as that is to say.